a report published on the World Diabetic Day in Times of India. It says that India is the capital of untreated diabetics. Everybody is aware of the numbers of diabetics we have in India. But what we really need to understand that India is the highest number, rather 90% of the Indians are not getting treated by the conventional thing. So probably we are heading towards a diabetic महाकुंभ. मैंने ये महाकुंभ को इसलिए कोरिलेट किया है क्योंकि महाकुंभ को आपने अभी रिसेंटली विटनेस किया है एंड यू हैव सीन क्रोस एंड क्रोस पीपल विजिटिंग महाकुंभ. और जैसा महाकुंभ में सिनेरियो था कुछ ऐसा ही महाकुंभ मैंने एक इमेजिनरी डेट ली है 12 साल बाद 2037 में होने वाला है ऐसा कुछ. सो दीज आर द ग्लिम्स ऑफ द महाकुंभ वी हैड रिसेंटली. यू कैन सी and also we had some other experiences including the biggest traffic jam in the world which was reported all across the world. So anticipating the difference, what Mahakumbh we are going to have diabetic Mahakumbh in next couple of years. So the Holy Mahakumbh 2025 which we recently witnessed was a desired one, but the diabetic Mahakumbh is undesired. The Holy Mahakumbh united the country, united the nation. This will divide. It persisted only for 45 days. This will be there for decades together. The Holy Mahakumbh boosted Indian economy. It will destroy Indian economy. Seen more good than bad scene. बहुत अच्छे scenes हम लोगों ने देखे. But largely bad scenes ahead. And the preparation done in India for Holy Mahakumbh. But the preparation for unholy or diabetic Mahakumbh is being done abroad largely, which we are not aware. So these are the recent newspaper headlines. हम लोगों ने 20 जनवरी को हमको पता चलता है कि 30 साल से ऊपर के 89 करोड़ लोगों को इंडिया में स्क्रीनिंग होने वाली है for diabetes, blood pressure and cancer. And we also had a GIC summit recently which you see that the Ambanis, Adanis and Bajaj all they are going to open a chain of hospital all across nation. And हम लोगों को पता है कि जब GIC summit 24-25 को खत्म हुई तो गवर्नमेंट ने दौड़ के जाके आचार्य बालकृष्ण को 432 एकड़ जमीन का हैंडओवर जाके उनकी साइट पे जाके दिया. सो प्रॉब्ली दिस इज अ काइंड ऑफ द प्रिपरेशन वी आर गोइंग टू हैव. सो वी ऑल नो डायबिटीज एंड मेटाबॉलिक डिसऑर्डर ऑफ chronic hyperglycemia caused by defect of insulin secretion action of both. Most common form of diabetes is type 2 diabetes, considered as induced by Western lifestyle. Rise in prevalence of diabetes is estimated to be 4 times high in developing countries. It is going very, very fast on developing countries. This is thought to be because developing countries adopting a Western lifestyle and increase in obesity, as rightly just said by respected Dr. Manoria sir, that obesity is the new epidemic. So this was rare in the first half of 20th century, even in USA, with less than 1% of population affected in 1958. Incidence and prevalence of type 2 diabetes increased in the second half of the 20th century in the developing countries. In the US, this was a similar scenario in 1980s. Less than 1% of the China's population had it, but it is more than 10% now in 2008. As far as the India is concerned, a study in 2008 revealed that 20% of the southern population suffer from diabetes. 2014 study revealed that 46% of the newly diagnosed diabetic patients are under age of 40 years. So scenario is getting changed. It's not a 1 day, 2 day or 2 year disease. It is a disease for lifetime. So probably we are heading towards an epidemic of different type for which probably we are not prepared. Contrast with the notion that patient developing in developing countries are overused 60 years. So incidence prevalence continue to grow. First epidemiological studies of diabetes in India which was done in 1970, more than 20 years, a prevalence of 2% in urban and 1% in rural. Just because two very important लैंडमार्क थे चेंज दिस होल सिनेरियो. 1917 में ग्रीन रेवोल्यूशन जो हुआ जिसने एक भूखे नंगे देश को ओवर न्यूट्रिशन में कन्वर्ट कर दिया. हम लोगों के पास खाने पीने को सब कुछ आ गया. सो ग्रीन रेवोल्यूशन इज वन थिंग व्हिच हैपेंड इन 1970 एंड देन 1991 a country which was on the verge of almost getting bankrupt, its economic door was opened in 1920 and allowed foreign investment. Liberalization, privatization, globalization quickly followed and country moved from undernutrition to the state of overnutrition and ultimately converting into obesity and diabetes. Motorized transport resulted into a steady increase of prevalence of type 2 diabetes. So 1991 Before that, it was at single digit, and after 90s, it is a double digit thing. And probably this dynasty of diabetes is still about to grow because of this digitalization era. We are aware of it. These are the data that every urban parents want government to do something about that digitalization so as to stop the children from just to stick to the mobile phone. ICMR study, yesterday Dr. Anjana Mohan has come. She did this wonderful study and bringing this data of 101 million people of diabetes and pre-diabetes 136. And although we say that diabetes is a silent disease, but I believe this is a partial truth. शुरुआत में diabetes बिल्कुल चुप रहती है, लेकिन बाद में ये चिल्ला चिल्ला के बोलती है. When a person have a diabetic foot, when person have a heart failure, when person have coronary artery disease, then it's not a silent disease. It affects individual patient. In fact, it does not. It affects the whole family. Saving one life from one complication, you save the patient from cardiovascular disease, and the patient is ready for the chronic kidney disease. It's a lifelong disease and resistance every level. We know that this is the prevalence. India itself is a whole world in terms of prevalence of diabetes. We know this is the prevalence of pre-diabetes, and we have distinctive features of type 2 diabetes with low awareness level, high prevalence of undiagnosed disease, unaffordability in the care, unavailable of trained medical staff and paramedical persons. So we have a huge problem here. And the problem of obesity, and from 2004 to 2024, the obesity incidence and prevalence has quadrupled, 4 guni ho gayi hai, because of the population getting more and more easy access to food as well as the transport and digitalization. So this is recently in the Dainik Bhaskar that we know that Coca-Cola has a 3 times sugar than what is served in the other country, but we are not doing anything about it. So this is the generalized obesity prevalence. I will not go in detail. We know that there are nephropathy, retinopathy, neuropathy, and macrovascular complication, huge in number. Even today, we every day keep on listing them. But what is going to happen? जो आपको पता नहीं है. Western countries सारी ये डाटा को एनालाइज कर रही हैं. आपको मार्केट की तरह देखते हैं. वो तैयार कर रहे हैं कि आपके पास क्या क्या वो अगले दशक में बेचने वाले हैं. But you are not aware of it. So this is a glimpse. We are cutting almost around 2 lakh foot as of today in India because of diabetic foot. जब ये 90% untreated, undiagnosed, uncontrolled diabetics अगले 10 साल में कितने फुट हम लोगों को काटने पड़ेंगे? Probably you are not aware, but these Western companies are aware. This is the data of their research. So, non-traditional complication, we are not familiar with this. This is the global target setting to reduce the burden of diabetes by 2030 by WHO. These are the targets set. So we know that this is a most challenging public health problem with diverse and extensive morbidity impacting individuals, health system and national economies. Studies have shown evidence base is suboptimal even in the well-resourced companies. तो मसला केवल इंडिया का नहीं है. Even US countries में भी जो HbA1c control है, it is only less than 50%. तो आप ये नहीं कह सकते कि सब हमारे यहाँ का मरीज सुनता नहीं. And only less than 20% meet all recommended target. It's less than 7 in India. But the problem is there all across. We know that there are multiple factors contributing to poor outcome, lack of awareness, poor acceptance, lack of education, cost, poor adherence, inadequate utilization of available resources, poor planning, failure to act on deficiencies. We know all of it, and a good care is being offered only to select population, और उनमें से भी because of the misconception, people are not willing to take the medication, and the non-compliance issue is big enough. So WHO sets a target for the member nation. 80% of patients with diabetes should be diagnosed. 80% of those diagnosed with diabetes should have HbA1c less than 8. 80% of diagnosed diabetes having a blood pressure less than 140. And 60% of diagnosed diabetes should be using statin, and 100% of the type 1 diabetes patients should have access to insulin. So my important thing is we always keep on discussing medication. And with multiple medication on board, सारी medication, दुनिया जहान की classes की medication के बाद भी हम लोग केवल less than 7% population को target achieve कर पा रहे हैं. And in Western countries, only 20% are achieving target. So my idea is that it is not only the medication which is going to work, it has to be something else. And we have to find out those innovative things. So the catch point in diabetes have a pathway to adverse outcome are modifiable across the broad continuum of its pathogen. लंबा रास्ता, कहीं भी आप इंटरवीन कर सकते हो. Many interventions are cost effective, which we are not using. Delayed or preventable through intensive lifestyle, population-wide change in dietary quality, physical activity, and level of obesity can make the problem in a better way. So the multifaceted approach is the need of our prevention, delay, remission, early diagnosis, affordable, accessible care, prevention of complication. Focus on strategies that work. उन चीजों पे फोकस करना जो काम करने वाली है. And we started educating the small doctors of the neighboring 5 districts, including Bhopal, Sihor, Raisen, Narsinghpur, and Vidisha. This is our small effort. We go and communicate to the small doctors, community health workers. So are we ready for the diabetic Mahakumbh? So the short answer is no. We are not yet ready. So the battle against diabetes, open secret of success, pata sabko hai. Promote healthy lifestyle by mass level awareness. Improve access to healthcare through doctors, CHO, nursing staff. Support research and innovation. Find out innovative ideas. Invest in medical research to develop better preventive strategies, treatment, cure for diabetes. Encourage collaboration between government, academia, and the private sector to innovate diabetic care. That's my request to all of you. Thank you very much. And for this small initiative, I invite you, all the postgraduate who are sitting here. The logo is लिखेगा इंडिया तभी तो आगे बढ़ेगा इंडिया. तो हम लोगों को छोटे छोटे मॉडल से पता करना है